Hello there. You are watching COVID Fellows, a video interview series with the administrative fellows working through the pandemic. Hi, everyone. I am Audrey Workman, an administrative fellow at Health Partners, and I'm here with a good friend and peer, Andrew Richards, who is an administrative fellow at UC San Diego in California. And he's here to talk a little bit about his fellowship experience and his health system's response to COVID-19. Andrew, thank you for joining today. Is there anything you would add to introduce yourself to our viewers?
Sure. So as it was said, I'm an administrative fellow here at UC San Diego Health. And initially, prior to all of the COVID-19 pandemic starting up, I was focused on innovation as well as operations within the Cardiovascular Institute. And so both of those are strong interests of mine. I've always been interested in improving processes and trying to find ways to make things better, which kind of leans itself towards hospital operations. And then about a year ago, through my MHA program, I had some experience in healthcare innovation, and that's really blossomed as an interest of mine. So I had some very interesting projects here at UC San Diego Health, working with the Chief Innovation Officer. But of course, with COVID-19, those things were put on hold as we had bigger priorities to take care of.
Yeah, could you tell us a little bit more about the structure of your fellowship? Is it a one-year program or?
Yeah, so it's a one-year program here in the Academic Medical Center, and its emphasis is on hospital and ambulatory operations and strategy. So we do have our ACO that we have some exposure to, but it's primarily focusing on projects within the hospital and within the physician group.
Mm-hmm. Is there anything that you would add to tell us a little bit more about your fellowship?
Yeah, I mean, I only have fantastic things to say about my fellowship. There are 3 fellows this year. They typically do between 1 and 3 fellows, and they do an excellent job of matching us up with our interests and with a preceptor who oversees the program, but then also an individual preceptor who has interests aligned with ours. And so it's been a great opportunity to get exposure to areas that I already have experience in, but also areas that I expressed a desire to grow in. And I think that's something that's really important for prospective fellows, to be aware of your weaknesses that you are interested in strengthening, and taking advantage of the 1 year of the fellowship where you're in somewhat of a controlled environment where you can try to develop those and grow. But I really only have positive things to say about my year thus far at UC San Diego Health.
Well, that's great. Yeah, one of the reasons I chose to pursue a fellowship as well was to explore interests and figure out where I wanted to land afterwards. So it sounds like you've been able to do much of the same and develop in those areas where you do have more of an interest.
Absolutely.
So Andrew, what are you currently working on to help your system respond to the COVID-19 pandemic?
I've had many opportunities to wear many different hats and spin lots of different plates. We are on day 93 here at UC San Diego Health of our COVID response. We were one of the first health systems in the country that received patients. We're very close to a military base, and so we received 2 airplanes full of both expats as well as Chinese nationals from Wuhan who landed here in Southern California and they were under watch and being quarantined. And there were a few patients under investigation as well as COVID positive patients. And so we brought them in here early February, and we had the opportunity to be one of the first health systems in the country able to learn and collect data and care for these patients. So initially, there were lots of interesting, unique challenges. We were trying to build our parachute as we were falling, so to say. Obviously, we had lots of great experience to emergency response, be it from other diseases and strikes or disasters in the area. But this was all a new learning experience for us and for our health system. And there were the little challenges such as the patients from China experiencing a whole new style of delivering care. There were language barriers, there were cultural barriers, And so little things like that to then the much bigger questions of, how are we going to make sure that these patients were safe, as well as keeping our community safe. But in the initial response, I was able to work in the hospital command center. However, for the last 2 months or so, I've been in the ambulatory incident command center, and I've had multiple roles. I've been the supplies manager for the command center, meaning I was the liaison between the clinics and then our supply chain team, making sure that they had all appropriate PPE and other COVID-related supplies, working to establish appropriate PAR levels now that things had changed and burn rates had, our previous burn rates and that data were irrelevant, and we needed to learn what the new normal was going to be. I've also been working in the labor pool a lot, working as a scheduler, assembling teams for many of the ad hoc projects that have come up, as well as working as an operations lead and analyst within the labor pool, putting together reports such as our utilization rates and our finances to make sure that everything's being captured and reported appropriately.
Wow, those are very interesting roles, especially I feel like PPE shortages has been a hot topic and a very real challenge for health systems across the country. And you got to be right in the forefront of that, Andrew.
It was exciting, yeah. And it was very interesting to see, as well as, and I have so much respect for our supply chain team, as well as the clinic managers and the clinicians working to make sure that everyone had their fair share, that clinics who were slowing down their number of visits were quick to offer up their supplies to other clinics in need. And the supply chain worked 24/7 trying to find sources of PPE and making sure that they were able to secure enough for our providers and patients.
Yeah, that's a big effort. How does the work that you're doing now compare to what you were working on before COVID-19?
As I was explaining what I'm working on now, it's much more day-to-day and much more operations focused. It's more focusing on putting out fires and trying to make sure that we and our staff are prepared for whatever's coming next. Whereas previously I was working on higher level projects that were strategic in nature, looking at ways to innovate or how to grow particular service lines, things that I really enjoyed and were very mentally stimulating and mentally challenging, but I was further away from the actual work and the care that was being provided. And I was further away from the caregivers and those giving care. So I have really enjoyed being able to have this change of pace and being able to work more closely with all of those who are really the ones putting their health and really putting their health at risk, providing for our community and for our patients. But it's really less of the high-level strategic work and more the day-to-day operations, which I've really enjoyed learning from.
Yeah, that's great. I've noticed a lot of leaders really rolling up their sleeves to support the frontline staff, and it seems like you've seen the same then with your leadership team. That
absolutely, yeah. No one's job is the same right now as it was back in January.
With everything that you've seen change, and with the changes that you have in your project work, what are some of your biggest takeaways and things that you've learned through this process?
It really has been a time of learning and growth. I've been able to observe the fantastic leaders within our organization, some of whom are former fellows, and being able to observe how they are coping and managing their work throughout this time. And I know that that's going to really be a great takeaway for me, as well as the things that I've learned about myself, whether it's learning of new strengths or weaknesses that I hadn't identified previously, or learning about new interests. And this has really been a fast-paced, challenging time that has helped me really reflect on myself, and it's helped me determine, where I might be a little more interested in taking my career. But I think that the greatest takeaway, and it's not something that's new information to me, but it's just been the reminder of the goodness of people and the goodness of those who work in healthcare as well as those within our communities. It's been amazing to see people and the great lengths they've gone to donate to the health system, or working in the labor pool as a scheduler for a period of time. It was not glamorous work by any means. It was around the clock, making sure that people were where we needed assistance. But seeing people who at a short notice would drop whatever they were doing on their day off and would go to work as a screener or as a nurse in a clinic or whatever it may be, people were just so ready and willing to help however they could. And people were frequently reaching out saying, hey, I ended up having a couple of free hours and I really want to help. Is there anywhere I could go? And that's been just a great reminder. And I think it's something that can sometimes be forgotten in the day-to-day work of healthcare. So I've been, despite all of the challenges and hardships with COVID-19, that's been a great reminder and something that I hope to keep with me throughout my career.
I'm curious. I think those are really valuable lessons. I'm curious to hear if you have any thoughts on how to really keep those things in the forefront of your mind moving forward throughout your career when we're not in crisis mode.
Yeah, I think that for me personally, I'll have a renewed emphasis on taking care of those around me, be it the patients, and giving more time and attention and resources to patient safety, as well as making clinician burnout a higher priority, and really figuring out how, in the setting that I am in, how I can provide the support that will help clinicians feel valued. And clinician burnout is a huge question, and it's on everyone's mind. But I think that hopefully after this crisis, when we have some time to reassess, that really will be something that time and money is going towards to figuring out how to solve. I also think that healthcare and how it's delivered will be completely transformed after this crisis. And, I say after this crisis, having no idea what that means or when that will happen. But I believe that there will be more emphasis on making sure we're not quite as lean in some areas, whether it's our supply chains and making sure that we do have more of a stockpile of PPE or whatever is deemed essential, that we're looking at our sourcing more thoughtfully. And I think those are all different ways that we can make sure we're more prepared for the next pandemic or crisis, whatever it may be, but also that we are really taking care of those who are delivering and receiving the care.
Yeah, that's interesting that you spoke about being less lean in some areas to help with emergency preparedness. Do you think that we might be more lean in other areas to counterbalance that?
That's a really good question. Something that I'm definitely going to have to think about, that if this will provide opportunities to be more lean. I know that obviously telehealth has exploded during this period of time, and so that could really reduce the amount of real estate health systems have to own, creating opportunities to be more lean in the ambulatory setting or in some of the non-surgical visits that patients have or non-procedural visits that patients have with their providers. So I think that would be a great opportunity to become more lean, and maybe that will help compensate for some of the areas that we'll have to maybe be less efficient, whether it's having fewer patients or focusing on social distancing for the long term, which would reduce the number of patients being able to visit a hospital or a clinic, or as I'd mentioned earlier, really stockpiling PPE more.
Yeah, it's interesting to think about those potential long-term impacts that really might be here to stay as a result of this whole pandemic.
It really is unfortunate that this was the catalyst for many of these changes, but I am hopeful that the changes such as the increase in telehealth will be here to stay, and that we can figure out how to make telehealth a viable business with reimbursement.
Is there anything else you would like to add for our viewers?
Yeah, I'm just grateful for everyone who, has been doing their part for COVID-19 and supporting either through providing care or supporting those who are providing care. Even those not in the healthcare industry, their day-to-day has been impacted and their lives have changed. And I'm just grateful that people have responded the way that they have to support and take care of each other.
Well, thank you so much for hopping on this video with me today. Thank you for sharing, and thank you for all the hard work you're doing to support the teams out there.
Absolutely. Thank you. Thank you for your work on this and for your example as a fellow.
Yeah, stay safe, Andrew. Thank you for watching COVID Fellows, an Admin Fellow video interview series. Follow Audrey L. Workman on Twitter or LinkedIn for more related content.